I want to talk to you guys today about the most common condition that we see here in the office at Jarvis Vision Center. It's called dry eye disease. About 16 to 30 million Americans suffer from some form of dry eye disease. That's up to 15% of the general population. So this is a very common condition that we see, and it's a big deal, but doesn't have to be accepted. There are ways that we can treat it and diagnose it properly. The first thing you have to understand is that when you deal with dry eye disease, you need to understand the signs and symptoms. The most common symptom that we hear patients complain of is a fluctuating blurry vision. This is what I call the roller coaster effect. It's where you can see clearly at the beginning of reading a book, and by the end of the book, it's blurry. Or you see clearly when you're on your computer screen, and by the end of those emails, it starts to blur off. The next thing that we look for is actually the surface of the eye. Here we're looking for redness. We're looking and asking about grittiness or sandy feelings on the eye. All of these things contribute to an irritability that just causes us to struggle with dry eye disease. There are several risk factors when it comes to managing dry eye disease. The first is aging. As we get older, the body tends to dry naturally. This can be seen primarily in females, particularly as hormone levels change. It can also be seen in patients that are taking medications that may dry their eyes out. These can be things like pain medications. It can be things like anxiety, depression medications, some blood pressure medications. Other things are the environment that you live and work in. Obviously, we're on screens more and more these days. Screen time dramatically reduces our blink rate, which ultimately results in dry eye disease. Other things that we deal with are modifiable. Some of those can be the amount of time that we spend in front of that screen. Other things we can do can be the amount of water we consume, or the types of foods that we eat. All of these things contribute to the progression of dry eye disease. There are two types of dry eye disease. The first is called aqueous deficiency. This simply means that there's a lack of tear production by the lacrimal gland. The second, more common one that we deal with is called meibomian gland deficiency. Along the lower and upper eyelids, there's literally like 30 to 40 glands there. Those glands secrete an oil. That oil has to mix with the water on the surface of the eye to lock the tears in place so they don't evaporate too quickly. This is the more common area that we deal with on a day-to-day basis. When we're looking at the eye through the slit lamp, we're able to look at these glands and analyze if they are inflamed or if they are capped off. If so, that means that the patient is going to have evaporative dry eye disease. So when we analyze the eye, we determine the risk factors, then we can create a treatment plan that's right for the patient. These can be simple things, such as those lifestyle modifications that we mentioned earlier. Less screen time, better diet, more water, possibly taking supplements like omega-3 fish oils. It can also mean simple things like over-the-counter artificial tears. There's prescription drops that you can prescribe. There's many things like Restasis, and Xiidra, and Cequa, all been around for a long time that help to show an increase in tear production and an increase in what we call the homeostasis of that tear film, meaning it's a more balanced tear film. There's also newer approaches that we're using in the office. This can be punctal plugs, which is a non-invasive procedure where we put a simple little plug into the tear duct to help the water volume build up over time, making the eyes feel more wet, which ultimately makes you more comfortable. It can also include newer procedures such as IPL, which stands for Intense Pulse Light Therapy. This is a procedure done over a period of time within the office where we can actually stimulate those meibomian glands to produce better oils. Better oils results in a more comfortable, clearer vision. The main thing to remember when dealing with dry eye disease is that it's chronic. No one treatment is going to cure your dry eye disease. Working with one of the professionals here at Jarvis Vision Center, we will develop a plan that is right for you. We'll help you guide you through that journey to get your eyes feeling more comfortable and get you seeing clearly so that ultimately you can focus on what matters most to you.